Good morning. Thank you for having me. I'm Dr. Antonia Oluwayemisi Soje. I'm a medical doctor. I'm a certified mental health counselor in the intricate field of trauma and addiction. I'm also a certified Christian marriage and sexuality coach. And I co-manage Hares Multi-Specialist Hospital and Foster Hares Mental Health Consultancy with my partner and my husband. My aim and ultimate life goal is to come to that point where every client, every patient I come in contact with, we're able to intersect psychology and biology and be able to understand how one would affect the other. And from that place of understanding, be able to steward holistic health for my patient. So by and large, I think that's the brief of who I am.
Thank you so much, ma'am. This is a very rich bio. We're so glad to have you on our wellness program. So we'll just be
Thank
quick so we don't take much of your time. The subject
you.
basically is mental health. And we would like to get from your opinion because most people don't actually love to talk about this subject. So in this case
Mm,
now, just help us do a brief explanation of what mental health entails and signs to
yes.
look out for when you have mental illness.
Thank you. The same way we have physical health, we have mental health. You're correct that most people don't like to talk about it. In fact, when someone says they are a mental health patient, there's the attitude of stigma towards them. But the same way we have physical health, we all have mental health. And mental health, if I would narrow it now, I would say is the seat of our psyche, how we express our psychological landscape in our everyday life. So it will be an intersect of our emotions, our will, and then our thought patterns. This will ultimately play out in how we carry out behaviors, how we steward ourselves. This will impact how we relate with people. This will impact how we show up at work, our productivity, and ultimately it will even impact how well we can be a positive contributor to the society at large. The same way, if someone struggles with physical health, maybe has a bit of impairment here and there, they can only do so much. So more than ever before, beyond the stigma, people also need to come to that point where they are outspoken. But I would say the onus begins with those who are in the field, who have been given the privilege of, would I say, stewarding the mental health field. We have to be outspoken, we have to be willing to talk about it. And then those who struggle and then they are in their recovery process. So should also be willing to talk about it. If we take it back a little, you remember when cancer was a stigma. So when people's parents even died from cancer, they would cover it and say it was something else because people assumed that it was contagious. But now it's no longer a stigma. You have people with breast cancer who are showing it out. And because of that, the awareness is out there. People are willing to go to the hospital early to have early diagnosis, early detection before it gets very bad. If mental health is destigmatized, we would not have many people presenting at the later stage. You would not have so many cases of suicide because the average person who is told that you have a mental health issue is, at least at the back of their mind, would not want to be interpreted as being weak, would not want to be interpreted as being risky or dangerous to the society, would not want to be interpreted as being, oh, okay, you're spiritually lazy. If you can pray about it, you should not be struggling. So these are the things we have to deconstruct and realize that just the same way physical health is important, mental health is also important, and everybody has it. And our intention is to come to that place where we are whole, we are robust psychologically.
Thank you so much. This really touches a whole lot of things, especially when you mentioned diagnosis. So the question I
Mm,
want to know, just like you said, if someone has a deformity, he knows that there's a
mm,
physical health challenge. So how do
mhm.
you tell that someone is mentally ill? What are those signs to look out for to show that this
Mhm.
person needs to be assessed for mental illness?
Thank you very much. You're correct. If you have physical ailment, you can identify it because you can see the body. What I usually tell people jokingly is touch your mind. Where is it? Some people will touch here. Some people will touch here. Is an abstract concept. So, but is the
Okay.
behavioral manifestation that lets us know something is off here and there. So,
All right.
usually start with the emotions. So, your mood, persistent sadness longer than 2 weeks, grief that is unending, anger that is not controllable. If you have someone who breaks a bottle and wants to stab someone, that person needs anger management beyond whatever may have happened. Something is off there. And that would not be the first time such an individual is finding it difficult to steward or manage their anger. Then those who have relational issues, people who struggle to set boundaries, people who have identity distortion. Then people who would struggle with substance abuse, behavioral abuse, addictions, and the likes. People who have persistent negative thought patterns or persistent negative thought patterns is the word. Something happens, you have an interaction with someone, and on a default, you're thinking of the worst case scenario. And you find that that's how you are on a normal day. Now, everybody can look well put together, you're well dressed, but because the mind is an abstract concept, you can't touch it. So there are many people who are well dressed who may be holding down a job, quote and unquote, but psychologically, their psychological landscape is in a state of turmoil. So if you find such observations, persistent sadness lasting longer than 2 weeks, persistent negative emotions, difficulty in sleeping, anger outbursts, rage, substance or behavioral abuse, difficulty setting boundaries such that anybody can push you and you really don't have a say. Identity distortion, you ask yourself, people ask themselves, who are they? They really cannot say it. The identity distortion is the extreme we now have in the Western world, where you have a 14-year-old boy who now says, no, I'm no longer a boy, I am a girl. Identity distortion. But it's a slow fade. It did not start like that all of a sudden. It's usually gradual. So someone who observes any of this in themselves will say, you are struggling psychologically. We may not be able to put a diagnosis yet until we sit with you. Now, relational problem is also another thing, because when you now come within the context of mutual relationship, marriage, for example, if you're both at loggerheads, why we would not say that individually you have a mental health issue, but the discord is a precipitating factor for disharmony in the house, and then there are children who are also watching that, who would experience the ripple effect of that discord. When they say when two elephants fight, is the grass that would. So any of this is enough reason for someone to say, I want to seek out a counselor, I want to seek out a therapist, I want to seek out a coach, as the case may be. And even if the person is wondering, where do I begin from? Start with a general medical practitioner. Many of them will be able to direct you to the next bus stop or the next person to be able to take the baton from there.
Okay. Well, you just exposed a whole lot of areas that ordinarily we would wish to prayers, just like you said. Some persons observe these things early and they say pray about it and expect that prayer will cure what counseling will ordinarily cure. So what I want to find out is, when these signs begin to manifest, how does it impact one's general well-being? Because it is when you notice that you can then say, okay, I need to see a doctor. So does it lead to maybe some kind of manifestation physically, or is just an emotional thing? How does it impact your general well-being? That's what I want to know.
It definitely impacts general well-being. Picture someone who has persistent sadness. You can be sure sleep will be off. Either they spend the whole day in bed or they struggle to sleep at all. If someone goes to bed and is not able to sleep, afterwards, what do you expect? There will be physical fatigue, there will be physical tiredness. Okay. If such a person is a student, you can be sure performance in school will begin to decline. If such a person is a worker, productivity begins to decline. If such a person is within the context of a relationship or holds down a position of responsibility, even if they were top-notch before, you see things begin to dwindle. Of course, there will be economic impact. So the same person who struggles to sleep because he or she experiences persistent sadness, now runs a business and has not been going to the shop, or the attitude in the shop is not the best, economic impact begins to set in. And then it's like a sequel. One will bet the next. And over time, persistent negative mental health state is a precipitant for physical manifestations, is a precipitant for hypertension, is a precipitant for autoimmune disorders. Autoimmune disorders, if I would explain it simply, is like the body soldiers would turn and then begin to attack itself. You understand? Precipitant for diabetes on a longer term. There are a number of papers to find a correlation between a negative mental state or chronic mental health conditions that is unresolved and how this will play out as physical health distortions. So someone who finds that they're already having these manifestations, please seek help. The earlier, the better.
Wow. I heard you mention diabetes, high blood pressure,
Yes.
fatigue. So these are really things to look out for when you start observing them. And like you said, it doesn't just start, it builds up. It builds up. Okay. So like you rightly know, the mood that we are in now, in terms of mood, I mean our location, Nigeria, there are a whole lot of things that people would ordinarily want to overlook, or you find yourself not being able to. I'm talking about some of the circumstances that we are facing currently. So I want to know, if you mentioned economic, most of us will always tell you that country is hard, country is hard. I want to know if these actually have a negative impact. These three things I'll mention now: the general state of the nation, then loneliness, and then a toxic environment. I want to know how these three impact on one's mental health.
Thank you very much. Okay, so I would begin with loneliness. There is loneliness, there is aloneness.
Oh, wow. Wow. Okay. Please, can you help us differentiate both?
I want to confirm if you can hear me.
I can hear you clearly, ma'am. I can hear you. Can you hear me?
Can you hear me? Can you still hear me?
I can hear you clearly. I can hear you clearly.
Yes, I can hear you, but your video is frozen. So I'm wondering, is it from my end or your end?
The meeting
okay, so I begin again. So we okay, so I will begin with loneliness. You know, there is being alone and there is being lonely. The two of them are different. I can be alone and not be lonely. By the time I get to that place of being alone and not lonely, I've learned to enjoy my own company. I've learned to build a life that is rich and robust without outside influences. I have learned to discover purpose, and I'm actively and consciously stewarding it. In fact, you find most inventors would usually need to take periods of solitude away so that they can do deep work, they can do focused work. Now, loneliness is different. It's a state of emotional disconnection from people. So someone can be in the midst of a crowd and they are still lonely. Now, human beings, we are emotional beings. Emotions is part of our construct. You know, I said the psyche is the emotions, the will, the thought patterns. So if I get to that point where I'm emotionally disconnected, whatever is happening, there's nobody I can run it by. Or I have come to believe that nobody would be able to understand. This would ultimately play out in my mental health. So an experience happens and I'm not happy about it. I have not stewarded the ability to process it within myself. And I also still have a perception that nobody would understand. Sometimes really nobody may, because you are in a toxic environment, which we'll now come to discuss. So that would allow the thoughts, the negative patterns to keep building up until it gets to a point where some people cannot bear it. Then they begin to contemplate suicide. Now, the average person who says they want to jump off the or wherever, you wonder, did you tell anybody? By the time you ask them, likely they didn't tell anybody. And that built up over months. It wasn't an overnight thing. The same way, if I'm also lonely and I'm emotionally disconnected from people, there's something that bothers me. I'm worried about it. I'm scared about it, but I've not spoken out because I feel nobody would understand. Emotions don't die, they metamorphose. Fear will become anxiety. Sadness will become depression. So you find that the negative emotion just keep building, and over time you could expect some negative psychological sequelae. Worst case scenario could then be somebody who finds a substance or a behavior and feels, if nobody will understand me, I can use this substance or behavior to escape that negative emotional state. What do you have happening there? Substance abuse, depression, all at the brink of loneliness, which if I would define it, just means emotional disconnection. You can be in a mix of people, but you're separated. Now for toxic environment is an environment that is negative, where you have criticism being perpetrated, where you have bullying being perpetrated, where you have how do I put it like this? A negative construct being perpetrated where you do not feel safe. where you're not
Okay.
emotionally seen, appreciated, or validated. Can be in a school setting, can be in a work setting, can be in a
In
home
the home.
setting. It's still the
In
same
the
thing.
home.
Human beings, we are relational humans. We are supposed to relate within a positive environment. There are a few,
Okay.
maybe I'll say a few 1% who can thrive in a toxic environment. Most other people cannot thrive. Now, for those who are able to change, what do? They check out. So either they leave the job, or they leave the school, or they leave that situation. But if they don't have the opportunity of living, it begins to perpetuate a negative cycle in their mental health state. So at the end of the day, mental health is not hinged on only what I do for myself. It's also hinged on what is the society around me. How are they
Doing.
impacting me? At the end of the day, our network becomes our psychological net worth.
Wow.
You talk religion, you talk school, you talk work. If you work in a positive environment, except there's a lot of things going on, psychologically you should be at least stable. You may not be robust, but at least you're stable. But if you work in a negative environment, it pulls you down. So if you can't check out, you really have to see if you can build inner resources or reach out for help to be able to manage such toxicity. Now, for the economic situation of Nigeria, it leaves many people in at the least a state of baseline anxiety because there is uncertainty about tomorrow. And then when we put the icing on the cake of the banditry, the average person
It's
sends their children to school and there is so much uncertainty as to will they return or would.
safe.
It's just a lot of absurdities. So the truth is Nigerians are a tough breed because I watched the video of the the flood issue at Lekki, and I was impressed to find people still in the opening their stores. People were still going to work. It tells of the average Nigerian's resilience because the economic crisis, the security crisis that the average Nigerian is going through, and then we are still above and still trying to push. It tells of our strength, but then we can tolerate it only so long before people begin to capsize. And then if that happens, you have anxiety, you have fears, you have worries. You may now have people even beginning to act out. So a little incitement that should not generate so much ruckus, and you have somebody who has blown off. Blowing off sometimes has nothing to do with you. It is at the backdrop of a lot of fear, a lot of worry that they have piled for a long time, and then they just express it on the next individual who incites it. My recording worked, but you were out.
I'm so sorry.
No,
Somebody
no
is
problem.
interrupting. Somebody's interrupting. But I could hear you up to the point where you talked about the economic situation of Nigeria. So you could
It was,
continue.
the recording will take care of it, so we can always go back and look at it.
All right, man. Okay, so we can continue from there because I was very interested in what you had to say there. How the economic situation and the insecurity, the banditry is affecting us as Nigerians.
Okay.
Continue.
So I said it leaves the average Nigeria in a state of perpetual fear,
Okay.
perpetual uncertainty. As humans, we are wired to want to control things. So control things be that you're facing it head on or you're running away and trying to check out. But then you picture the banditry, the unpredictability around it. Where are you running to? Where are you checking out from? Or you picture the economic situation where money is losing its value. Whatever it is you had by January, you cannot be sure it will still purchase the same thing by December. And then even those who are working, or those who work for government or who work in private settings, you look at the take home. Can you really take many people home? So there is that continual sense of being frazzled, being worried. Many people go to bed and the worry is, how do we make ends meet the next day? It's not a normal state to live. Stress should come in aliquots. It comes in a short burst. You overcome it, then you recover. Another one comes, you overcome it, you recover. Of course, every time you overcome it, there is that positive feeling of, yes, I got better. I improved myself. But the Nigerian stress is not that type. It is pervasive. It is persistent. It is continuous. And when we continue in that kind of state of stress, it leaves even the best of us at the risk of burnout. at which people begin to express irritability, anger issues, poor sleep, and a number of other things. If you find two people on the street shouting on top of maybe something as insignificant as corn of 200 naira, it may not be about the corn. It's repressed anger and repressed anxiety, and then people burst out. Okay. You understand? People are just expressing burnout because the pressure and the stress has gone on for so long.
Yes, that's gotten to level of this has really attended to a whole lot of things. So the question now is, since you say we can't escape our present reality, especially those of us who don't have the means of jetting out, what are the measures we can build up to at least curtail the insurgence of mental illness? Because as much as possible, in the midst of all of this, we don't want to get to the point where we will now resort to suicide or breaking bottles, like you mentioned in one of the explanations I tried to give. How do we build up that capacity as humans to resist the inclination to be mentally ill in the midst of all of this that you have mentioned?
Thank you. So now the same way, if we look at, if someone asks me the question, how do I build up physical stamina? I would say eat well. I would say do some exercise. I would say sleep. I would say go for checkups. And I would say if you have a medical condition, make sure you're regular on your drugs. Now, if we just suppose this within the context of mental health, the first is also still be sure you're sleeping. Take it one day at a time. I'll tell you what I mean. Someone who is within the context of a challenging financial situation, and then maybe all hell is breaking loose, I usually take it down to the last minute. We are both on this call. While we hope to see the evening of today, it is not promised to either of us.
That's true.
So if I'm here with you and I'm getting frazzled about what would happen by 8 p.m., it robs me of enjoying the peace and the bliss of this moment without guaranteeing the. That's what I meant by we must, by virtue of the, would I say, the misfortune that, or the challenge that the average Nigerian is experiencing, we must come to that place where we take it one day at a time. One day at a time that I would usually recommend for clients is, if it bothers you too much, find someone to speak to about it. If you don't have someone to speak to about it, write it. Write it is like a mental dump. Call it journaling. If I start to worry about what is going to happen by 8 p.m., in 2 minutes, I can worry about 10 things in 10 different trajectories. If I decide to write it down, I cannot worry about 10 things with pen and paper in that period. That act of onboarding, because I don't know how much of this I can explain without going too medical. We have two primary responses in our mind. We have the fight and flight. That's the sympathetic. That's like something is happening. You need to go. Either you're fighting or you're running. And then you have the parasympathetic that tells you, calm down now, not a big deal. You need both of these to be at play every time. You know that changeover, they used to change lights.
Yes.
The average Nigerian is stuck in fight and flight. We're either fighting or we're running. You still need these positive mental health activities to be able to bring you to parasympathetic. Calm down. You can only do so much. Journaling is one of such. Sleeping is one of such. You understand what I'm saying? Because fight and flight, if lion is chasing you, you are running. If lion is chasing you, will not pick a paper to write. By the time you pick a paper to write, it automatically begins to recalibrate your brain. Okay, we are not in danger. We're not in danger. Even though the world may be in danger, we are not in danger. Let us calm down. So you begin to have neurotransmitters, that's like brain chemicals, that calms your nervous system and it even calms your biology down. You'll be able to sleep better. Then exercise is also one of such things. It releases a number of neurotransmitters, brain chemicals, if I can use that word, that like positive boost, helps you to calm down. So that's for that one. Another thing, whatever faith you have, prayer is a necessity. Because while there's that feeling of I cannot control it, once you engage in prayer, it's like you yield it to a higher power. Any faith you engage in. So at the barest minimum, psychologically, again, you are settled. It's still parasympathetic in place. You have given it to a higher power. So it's beyond my power. I've given it to a higher power. So we take care of that. Then someone who was diagnosed with any form of mental health issue, your drugs, you don't want to play with it. That would be like someone who has hypertension and is saying Nigeria is hard. I cannot afford to buy antihypertensive. The complication of that is stroke. Stroke is costlier to manage than hypertension. So someone who was diagnosed, you want to be regular on your drug. Someone who even feels I am not coping well, go and find someone. That would also be the undiagnosed hypertensive who is having headache. You don't wait till you stroke. You find somebody to diagnose you and place you on drugs. So find someone to talk to. Could be your clergyman for those who are like, where is the money for therapy? Begin with the clergyman. Where's the money for therapy? If you have a general medical practitioner, maybe your family doctor, find someone to talk to. And if that is not working, there is the grandma, there is the great grandma. Before all of this advent of mental health practitioners, people could still talk to people because family unit was really like this. Nothing says we can't go back to that. Now, physical health, I would say avoid junk food. The junk food of mental health is media. Media must be intentionally stewarded. The average person who consumes media unintentionally is injuring their mental health. I'll tell you what I mean. Regardless of your baseline emotional states now, if you spend 1 hour that is not well-intentioned and well-stewarded on Facebook or Instagram, at the least you come back feeling like your life is not good enough. So the discontentment sets in. If I am discontented, I'm unhappy. And then I begin to strive. What has happened? You've compared your behind the scene with another person's highlights. There's nobody that shows up the reality of their everyday life on media. So we want to be intentional. Then we also want to be intentional about the circle that we surround ourselves with. Your network is your psychological net worth. So both the physical circle, the media circle, what are the things we consume? If I want to be physically fit, I will not be the one who takes 3 bottles of Coke every day. You also will not want to be the one who consumes 2 hours of media every day. So and I think by and large, most of this, we should be able to steward mental health on a longer term. Take it one day at a time, journal if you can, meditate, pray, exercise. If you have a mental health issue, please be consistent with your medication. Surround yourself with positive circles and positive influence. Then find meaningful work. Meaningful work is that thing you see yourself doing that if money was not a problem, you will continue it. On a spiritual term, on a psychological term, it's a positive boost that it gives meaning to life, even in the midst of challenges. Meaningful work for some people could be sewing clothes. Meaningful work for some people could be daycare. Meaningful work for some people could be cooking for people, could be cleaning your parents' house. But find that thing, let no day pass that you don't do anything, not for money, but just for the sheer pleasure of I have been useful. I have been a positive contributor to society today. As you give out, it comes back inside. So I would say if we all incorporate that one day at a time, the situation may not shift, but at least we've built the internal stamina and the internal resource to be able to deal with the challenges and the curveballs that Nigeria is throwing everybody.
Wow, this is really, really, you have just nailed the whole conversation. You have given us practical tips to manage mental health. And these are tips that any human can relate with. But please, I just wanted to clarify, when you mentioned exercise, what kind of exercise? Because I'm assuming that it has to be physical, not mental. But I don't know. Are you referring to a mental exercise or a physical exercise?
Thank you very much. Both. But importantly, physical exercise. Mental exercise briefly will be that you're consuming materials that is charging your brain. So it could be a course, could be a book. I know these days people will say everybody is not a reader. No, anybody, all leaders are readers. That's just the way it is. If we will lead mentally, we must be readers. But the physical exercise is you just get your body moving. The human being is meant to be a machine that moves. Sorry for the use of such word. So if you want to put statistics or number to it, it will be you're going for 30 minutes 3 times a week, and it should make your heart race. So if someone who does not do any exercise and trekking 30 minutes makes my heart race, that's my target. If I'm someone who treks a lot, 30 minutes will not make my heart race. So that would then be jogging. If I'm someone who is used to jogging, that would then be running. 30 minutes 3 times a week is 150 minutes. That's the medically recommended target. Then you can up it at the barest minimum. You can up it as your time will permit, as your stamina will permit, as resources are available to you, as the case may be. So it can be anything. It can be skipping, can be running on a treadmill, can be a press up, whatever it is that will work, and could be house cleaning.
Okay. Okay. Now that one is easily relatable. As long as it's as well as and the hello, ma.
Yes, I'm with you.
Thank you so much. Okay, before I let you go, I just want to present two quick scenarios to you
Yes,
to
yes.
help possibly manage their mental health. So we recently heard that the kidnapped children from Oyo State have been released. And we can't even begin to imagine the trauma they must have gone through. So for these people, what's the tendency that this experience would affect their mental health? And how do you begin to resuscitate their mental health from this kind of experience that was imposed on them? That's one scenario. Maybe you finish with this and then I present the other one. That if
Okay.
someone happens to have a relative among those affected. Thank you, ma'am.
Thank you very much. It's actually a very, very sad experience. Even the thought of it, it's heartbreaking. Now, for
Mm.
someone with such an experience, probability that they would have a post-traumatic sequelae is high, but not 100%. Is
Okay.
dependent on what their baseline mental health status is like. A child who was not struggling at all, for whom parents were doing their best, the environment was relatively safe. They were not in a state of deficit before it happened. Then coming out from such, there's someone to also still absorb them and still be able to continue a positive parenting. And many of them will be able to adapt. If you relate it to physical health, maybe someone has been physically fit, then was involved in an accident. If you're able to take them to the hospital and then you treat them, you would only find a scar, but not that they
Yes.
will limp through life. Not that they will
Okay.
limp through life. Or somebody may be very physically fit, then was involved in a very bad accident, but they didn't
Mm.
find care later. They will likely limp through life. So you will know that accident has marked them. So now, just opposing this to these bandits, these people were kidnapped. The kidnap experience, the simplest way we can look at it is also like somebody who had a physical accident. So they had a psychological accident of massive
Okay.
scale.
Mm.
If they were healthy before, the impact would be there, but their ability to recover will be better.
Okay.
Recovery then is hinged on what is the society that they are being reintegrated into.
Mm. Mm.
And assuming the worst case scenario that every accidented victim that does not get to the hospital will live with the sequelae of the accident for the rest of their life, these people should have a positive, well stewarded integrative mechanism. I'll tell you what I mean. What happened at the site? There should be someone that they can talk it out with.
Okay.
Likely, they are not talking it out at home, or if they're talking it out at home, they are not processing it.
Okay.
A child was beaten with rod, was tied with ropes, and comes back to tell you about it. That's not processing. I need to now ask you, how did that make you feel?
Yes.
Did you come to believe about yourself, about life, about people?
Mm.
And how is
Mm.
this affecting the way you're showing up? So I hear you. And then we now
Mm.
begin to deconstruct all the negative beliefs and the experiences that will come from there. Every
Mm.
experience will leave us with a set of beliefs. The world is not safe. People are not safe. People are mean. People are wicked. Now, if I go through life with that belief at the back of my mind, I am either set out to attack people or I am set out to avoid people. Neither of this is functional.
Okay.
But at the age of 10, someone sits with me and make me understand it that not everybody is bad. Some people are. and these are the people that you unfortunately fell into their hands. This could take a week, this could take months, based on how healthy is this child psychologically before. But at the least, they should have therapy in which somebody sits and helps them make sense of this experience, because they would probably be having hypervigilance. Hypervigilance is, vigilance is the word vigilance. So when you put hyper on it, you are unduly watchful, unduly agitated, you cannot sleep. Then they could be having flashbacks. So that would be the 10-year-old who sleeps and then is having flashback memories, very vivid memories of what happened in the kidnapped den. These are things that they want to bring to therapy and process. Now, supposing this person is my relation and therapy is not available, at the least, I will say, sit and let's talk about it.
Okay.
Talk about it. What did you come to believe about that? What were your emotions? What they came to believe, it also means that if I'm sitting, I realize that everybody is not like that. Some people are like that. So I want to deconstruct that negative hold in the mind of that child. And you, how do you feel today? Okay, I'm still scared. I understand. I understand that you're still scared. What can I do to make you better? Can I sleep in your room? Yes, please do. Is there any other thing we can do? I'm not ready to go to school this time. It's all right. Let's see what it is we can do. Can we homeschool you for the meantime? Those are realistic things for those that therapy is not available, but somebody should sit and give them voice so they can have language for that which is going on here that they cannot express.
Yes. It's really something that one can actually relate to. I'm really, really grateful for these tips that you have mentioned. I don't know if you can spare me like 5 minutes for the second scenario, because our time is
Yes.
okay. So thank you very much, ma. So this one now has to do with someone that is mourning. Maybe you lost someone because I recall you mentioned aloneness and loneliness. And you also said people process grief different ways. So somebody just lost someone so dear and has been quiet for a long time. Long time could be like weeks. You don't say anything to anyone. You're just quiet and you're just watching life go by. So how do you, of course, this person may not necessarily be mentally ill, but that's their own way of processing grief. So how do you help such a person that just wants to be alone and not say a word?
My interest is, I also want to know what this person's premorbid mental states and personality was. If this is a quiet person right from time, that may be their way of processing things. But if this was someone who was very outgoing and all of a sudden is withdrawn, it may be an alarm bell. I will not call it a mental health issue yet, but it's an alarm bell for us to probe further. Then I'm also interested in the relationship with the person that this individual lost. Spouse, a child, a parent, an only child carries bigger weight than a friend or than an extended relation. So I'm interested in that relationship because this individual you're describing may even be in a normal stage of grief. Grief has 5 stages. There is denial. You know, when you tell someone died, they say, Lila, it's not true, it's not true. They keep telling you, no, I don't believe it, I don't believe it. Some people even be with the person and be like, they will still wake up. That's still denial. Then there's the anger at which they are looking for who to blame, or sometimes they may even blame themselves. Maybe if I had done it better and this and that. Then there's depression. Depression stage is when most people will withdraw.
Okay.
That's when they mourn, cry, they're not sleeping, they're not eating. You understand? Yes, then there's that bargaining phase of, so can we still bring them back? Is there anything we can still do? Before people now get to the acceptance, okay, it has happened. Now we move on with life. For some people, this could be 1 week. For some people, this could be two months. For some people, this could be 3 months. Usually, if grieving is lasting longer than 3 months and the person's functionality is diminished, I tell you what I mean. Is a student now is not longer able to go to school. The person works. This is the 4th month. He has not opened the shop. Or the person used to come for church activities. This is the 4th month. We've not seen them. And when we call, they don't pick up. That then becomes a pathologic grief. So that's why I say it's difficult to just interpret based on this. But whatever stage this individual is, even if the person is not coming out to speak, I will still want to initiate conversation, initiate relationships. Relationship will be that I go visiting you. If you're someone who eats, I will cook food and bring it for you. You may not be somebody who watch movie, but I will say, let's watch some movie. Just to try and see if we can get them speaking. The quiet attitude is like they have put a wall or a door, but you will be the one who is intentional about seeing to it that we open as gently as we can. That may be all they need to begin to open up.
Okay. This has really, really helped. Thank you so much, ma. I really want to appreciate your patience, all the information you have really doled out to us. We really appreciate you. It's a whole lot and very useful to our audience and all those who will intentionally stumble on this recording. I really want to appreciate you and then pray that God continues to strengthen you and your husband for the work you do. Amen. And give you many more years in good health and bless all your good heart intentions. So thank you so much, Ma. I really appreciate you. And I'll be looking forward to when next we'll meet, possibly physically, so that we can.
Hopefully.
Thank you so much, Ma. We enjoy the rest of the Saturday.
You too.
Thank you.
Yes, so I will record. It's being recorded anyway. Once it's ready, I'll send you the link so you can download it.
Thank you so much. I really appreciate that, Ma. Thank you. Thank you so much. Thank you.
All right. Have a wonderful weekend.
You too, Ma. Thank you.